Hello and welcome to Dr. Rodman's Story Time. Today's story is the story of a lip lift. Now, this beautiful young woman came to me originally requesting lip filler, has a thin upper lip, wished to have more volume and to turn it out a little bit. Now, this is a pretty difficult lip to fill because patients who have a thin upper lip that folds under like that can get some lip filler, but it needs to be done conservatively to avoid too much horizontal projection. I did a little wrestle and kiss, one of my favorite lip fillers in her. As you can see, gave a little more volume to the top, a little bit more to the bottom. Nice result. She was happy. We all were happy. I've known this patient for a long time. She came back several times over years to have more filler put in her lips. As a facial plastic surgeon, it's my job to tell patients when is enough. And in this case, I pointed out to the patient that some of her filler had started to migrate a little bit above her lip, and that the amount of horizontal projection she was getting, making the lip look like a shelf, was probably too much. And so we had the conversation about a lip lift. What a lip lift does is it increases the vertical show of the upper lip, but it does not add any projection. So for patients who have a lip that's thin because it tucks under, a lip lift, where I'm able to actually flip it and lift it up a little bit, is the perfect solution. And so here she is, 5 weeks after her lip lift procedure, which was done in the office. As you can see, her lips flip up, and so we have vertical show of the upper lip, the red lip, but without the projection. Still is a little bit swollen, so there's still a little bit of projection, but that will settle down over time and not look like a shelf anymore. Also, you can see that this scar here under the nose is healing really well. It's already barely visible. It's only been 5 weeks. Scar generally heals really well, especially if patients follow all the post-op instructions, and hides nicely in the crease under the nose. It's a great procedure done in the office. To see if you're a candidate, come in for a consult at Phase 4 at Houston.